Bonjour et bienvenue à notre dernière mise à jour économique avant la levée du Parlement. On est triste. Je vais d'abord vous présenter une survol de l'économie canadienne. Le ministre Mark Holland va ensuite présenter un aperçu de notre nouveau régime canadien de soins dentaires. La ministre Jenna Sudds va discuter de notre nouveau programme national d'alimentation scolaire. Enfin, la ministre Anita Anand va parler du travail que notre gouvernement fait pour sévir contre les frais indésirables et rendre la vie plus abordable pour les Canadiennes et les Canadiens. Earlier this month, the Bank of Canada lowered interest rates, making Canada the first G7 country to do so. Interest rates are coming down because inflation is falling. Inflation fell to 2.7% in April, down from 2.9% in March. That is 4 months in a row that inflation has been within the Bank of Canada's target range. That is really good news. In fact, inflation has now fallen to its lowest level in 3 years, and wage growth has now outpaced inflation for 15 months in a row. Last week, the International Monetary Fund released its annual Article 4 review of the Canadian economy. And in that statement, the IMF commended Canada's strong fiscal credibility and economic resilience. Specifically, the IMF credited our government for adhering to the 3 fiscal guideposts we introduced in the 2023 Fall Economic Statement, which complement our government's fiscal anchor to reduce the debt-to-GDP ratio over the medium term. We met all of those markers in the 2024 budget. And the IMF recognized that the Canadian economy appears to have achieved a soft landing, avoiding the recession and heartbreaking surge in unemployment that many had thought was inevitable. In fact, today, almost 1.3 million more Canadians are working compared to before the pandemic. The OECD expects the Canadian economy to see the second fastest rate of growth among the G7 this year, and the fastest growth in 2025, tied only with the US. After our budget was tabled in April, Moody's and S&P, 2 of the leading credit ratings agencies, reaffirmed Canada's AAA credit rating with a stable outlook. Il s'agit d'éléments de preuve convaincants sur le plan économique. Ces preuves montrent que l'économie canadienne est forte et qu'elle est résiliente. Elles montrent aussi que notre plan économique est financièrement responsable. C'est important parce que ça veut dire que nous pouvons nous permettre de faire les investissements et de créer les bons emplois dont les Canadiennes et les Canadiens ont besoin. Cela veut dire que nous pouvons nous permettre d'investir dans notre régime de soins dentaires. 2 millions de Canadiennes et de Canadiens ont déjà reçu l'approbation pour recevoir les soins dentaires dont ils ont besoin auprès des dentistes ou des hygiénistes. Cela veut aussi dire que nous pouvons investir dans un programme national d'alimentation scolaire qui va aider 400 000 enfants de plus à avoir la saine alimentation dont ils ont besoin pour apprendre et pour grandir. Now, we know there are some, like the Conservative leader, who don't share our priorities. Pierre Poilievre has voted against our budget, which means he voted against investments in housing, in childcare, in healthcare. He voted against making our tax system more fair so that we could afford to invest in Canadians and to deliver to younger Canadians the opportunities that they deserve. He has shown time after time after time that he is always on the side of those at the very top and against the interests of working Canadians, of working people. Pendant que le Parti conservateur cherche toutes les excuses possibles pour réduire les investissements dans les Canadiennes et les Canadiens, notre gouvernement agit maintenant. Et il agit résolument. Parce que les Canadiens et les Canadiennes comptent sur nous. Merci. Et je vais maintenant céder la parole au ministre Mark Holland.
Thank you so much, Minister Freeland. So it's a pleasure for me to give an update on where we are with the Canada Dental Care Plan and some of the key dates that are coming over the next couple of weeks. So in the first order, folks will be aware that more than 2 million eligible seniors have enrolled. Pour les provinces de Québec, c'est 700 1000 aînés sont inscrits dans le programme et c'est remarquable parce que c'est presque exactement le nombre de personnes qui sont eligible pour le programme. Alors ça, c'est absolument remarquable. Le pourcentage de professionnels de la santé bucco-dentaire partout au pays est plus que 40%. Et au Québec, plus que 60% de professionnels. C'est remarquable aussi. And what does that mean in practical terms? In the first 6 weeks, it means more than 200,000 seniors have gotten service. And I just want to take a minute before I talk about some of the upcoming dates to speak in practical terms about what that means. When I was in Edmonton last Wednesday and met with Bill and talking to him about from a pocketbook perspective. He has a number of concerns about his oral health, and for him to be able to come in and see a dentist and not take away from his fixed income was huge. And Bill knows that that means not only great things for him right now in terms of reducing his cost of living, but it means that he can act preventively about his oral health so that he doesn't wind up in a hospital room. And to be more pointed about that, when I was in New Brunswick just a week or two ago and was talking with a dentist who said, look, I can go look around New Brunswick and I can tell you exactly who doesn't have oral health care. And we're a small community. Those people, on a Saturday afternoon, I'm going to get a call pulled away from my family, and I'm going to be asked to come into an emergency room to do an entirely unnecessary procedure on somebody who should have been able to get the care in advance. The cost of that is staggering. Prevention is so critical. And, you know, there's also something to be said. As I was on my way to Edmonton, a lady stopped me who worked in a long-term care facility and was talking about the seniors that she's working with feeling seen and having a sense of dignity, that they were cared for, what it meant for their affordability. Put it in a very direct term, our service center got a call from an 87-year-old lady in tears, overjoyed for the first time since she was 11 years old, she was able to see a dentist. So really her entire life in tears and appreciation and gratitude. And we think about the impact on their mental and physical health as well as cost, it's huge. And that's why we're so excited on June 27th that we'll be rolling out the next part of the Canadian Dental Care Plan, the Canada Dental Care Plan. On June 27th, those who are 18 years old and under, and persons with persons with disabilities who are eligible for a tax credit, will now join those who are able to get service. And that is met, as I said, by about 40, a little over 40% of health professionals, oral health professionals who've signed up. And the key date that is also going to buttress this is July 8th. We've been working very closely with the dental associations to say that as of July 8th, they won't have to participate in advance. They'll be able to operate on a claim-by-claim basis. That means, as I said, Quebec is over 60% of oral health professionals participating. We expect very soon to see most provinces being over half of oral health professionals participating. So I certainly would put it back to dental associations. If over half of your members are participating in the program, we're hopeful that you will be too. In November, we will begin pre-authorization. This is critically important because there's a lot of more complicated oral health issues. But just as we've worked in other processes, and I've talked to health providers, oral health providers who say, like, you know, the Conservatives keep talking about all the red tape and problems. I'm like looking behind my computer and I'm wondering where all this stuff is. It's been working extremely well. And how do you know it's working well? Because they don't have a case to point to where it wasn't. And that's exactly the type of service we're going to continue to deliver. What we're hearing from dentists and hygienists and denturists is in most cases they're getting paid in just 12 hours. So we're more than meeting our 48-hour service commitment. And we've got that process down to just what is needed, actually easier in most instances than the private plans they're working with. That's our commitment to have that kind of pre-authorization system that's going to come in November. So lots of exciting things there that I think have huge implications for both health and affordability, and we're excited for the days to come. With that, I believe, Jenna, I'm turning it over to Minister Sudds.
Thank you very much. Good afternoon. Bonjour tout le monde. As the Minister for Families, Children and Social Development, I am focused on making life more affordable for Canadian families and ensuring that children in this country have the best possible start in life. The Canada Child Benefit, which parents receive monthly, will arrive this Thursday, this week, and this provides important financial relief for families. And in fact, since we introduced the Canada Child Benefit, it has helped lift hundreds of thousands of children out of poverty. En mai, nous avons annoncé des ententes sur l'infrastructure pour l'apprentissage et la garde de jeunes enfants avec toutes les provinces et tous les territoires. Ce financement aidera à créer plus de places en garderie et à réduire les listes d'attente. I also continue to work with my counterparts to ensure that the early childhood workforce is well supported and well compensated. Just last month, Newfoundland and Labrador announced that they will be introducing health benefits to the early childhood workforce using Canada-wide funding. This will help, of course, attract, but also to retain this critical workforce. Building a high-quality, inclusive, and affordable early learning and childcare system is just one piece of our plan to support families and children. Of course, with increased cost of groceries for some, we've also seen that sending their children to school with a healthy lunch has become a struggle. And so our government has set forward a path to help parents with this. The National School Food Program, as was announced in Budget 2024, has the ability to provide additional meals for students at school, up to an additional 400,000 meals. This will save parents on average of about $800 a year. This is real, targeted support for parents, and will also ensure that kids can focus on being kids and can focus on learning. I'm having positive and productive discussions with my provincial and territorial counterparts, and I'm confident through our collaboration that this funding will expand on existing programs and get meals into as many kids as possible at school. The National School Food Policy itself will be announced very soon, and it will include key objectives and guiding principles that will help to direct this work with the provinces and territories. Nous croyons qu'il est important d'investir dans les gens, car ces investissements ne se limitent pas aux Canadiens aujourd'hui, elles auront un impact pour les années à venir. As I've just articulated today, our priorities for families, it's important to note that the leader of the opposition and the Conservative Party have also made their priorities clear. Cutting essential programs that families need. But we will not let them distract us with their cynicism. Nous continuerons d'appuyer les Canadiens, de réduire le coût de la vie et de faire croître une économie qui place mieux les jeunes pour réussir, aujourd'hui et pour les générations à venir. This is what Canadians expect from us. This is what our government is committed to doing. We will be there to fight for Canadian families, and we will have your back. Thank you very much, and I will pass it to Minister Anand.
Well, thank you so much, Jenna. Et aujourd'hui, je suis ici pour discuter l'abordabilité et aussi les frais indispensables. reducing the cost of living by cracking down on junk fees, which are hidden fees such as NSF or non-sufficient funds, has been a work in progress for our government, and we are making steady progress with it. Depuis 2016, par exemple, nous avons pris des mesures pour réduire les frais indésirables qui ajoutent du stress pour les familles canadiennes. And we are taking consumer protection measures to address these charges. For example, in terms of the fall economic statement, we highlighted NSF fees charged by banks, and these are processing fees that hit consumers doubly hard if they do not have sufficient funds to begin with. And so through Budget 2024, what we're doing is taking this initiative one step further, and I'm going to outline 4 succinct points before concluding. First of all, nous travaillons avec l'Office des Transports du Canada et les compagnies aériennes pour rendre plus transparent le coût total d'un vol, afin que vous puissiez choisir les tarifs qui répondent le mieux à vos besoins. And this is going to help not only consumers to save money up front, but it's also going to encourage more competition amongst the suppliers who are at the table vying for your business. Deuxièmement, en plus, nous travaillons à la modification de la loi sur les télécommunications pour que vous puissiez avoir votre mot à dire sur les plans moins chers et sur la possibilité de changer facilement d'opérateur. In particular, Canadian consumers are going to see certain specific changes that I'll briefly outline, prohibiting telecom companies from charging consumers extra fees just to switch providers, and requiring companies to identify cost plans for consumers. So if there's a lower cost plan that would work for you, they're going to have to tell you that. Our pressure in this sector has been effective. Recently, the 2023 price comparison study of telecom services found that wireless prices have declined on average 18.2% for data plans and 8.6% for home internet plans with the universal access target of 50 Mbps. And third, just in terms of the Competition Act, you've heard us talk about the Competition Act quite a lot over the past number of months, but we are modernizing the Competition Act to further strengthen the law against hidden fees, from prohibiting drip pricing to allowing private parties to bring certain deceptive marketing cases directly themselves to the competition tribunal. And then fourthly and finally, on NSF fees themselves, we are going to cap those at $10, where banks used to be able to charge up to $50. We are also going to crack down on predatory lending by introducing amendments to the criminal code to enhance enforcement of the criminal rate of interest. So you can see that there are a number of items on the table to enhance the ability of Canadian families to cope in difficult economic times. And in closing, what I'd like to say is that consumer protection does not happen without advocacy from government and from other agencies, all of whom are concerned to ensure that consumers aren't hit with hidden charges. We at the federal government of Canada are leading a Canada-wide effort to crack down on junk fees, including supporting consumer groups' independent research and advocacy against junk fees in particular. And we are here to do this advocacy in the form of legal reforms and amendments for the benefit of Canadians and Canadian families across this country. Merci beaucoup.
Thank you very much. We'll start with questions in the room. One question, one follow. We do have many people in the room, so we will try to go online if we can at the end. And if you are online and have a question, please use the raise hand function. And we'll start with Mackenzie Gray from Global News.
Hi, Minister Freeland. You previously said the Liberal Party would do an internal follow-up on the NSICOP report. Can you outline what this follow-up will look like?
Thank you very much for the question, Mackenzie. We take foreign interference very seriously. It is entirely unacceptable in our political system, and that is why the government has expanded the mandate of the Hogue inquiry to include a review of these materials. That's the appropriate next step, and that's what we're doing.
So you're not going to have a follow-up then, by the sounds of it? Can you give us any details of what that will actually look like?
We are having many conversations about this, and that's the right thing to do. These are very delicate security matters, and that is why we set up the Hogue Commission. It's the right thing to ask Justice Hogue to expand her mandate to continue the review.
Rachel Haynes, CTV News.
Thanks. Minister Freeland, I want to ask you about the equalization formula and some provinces that have launched a challenge about the formula. Newfoundland announced and Labrador announced last month that they are going to launch the constitutional challenge of equalization. Premier Eby said he'd be looking into joining them as well, and both are citing issues of fairness with the current equalization formula. Have you responded to their concerns, and are you willing to revisit the current formula?
I have... Premier Fury and I have been in touch, and I am likely to have a conversation with Premier Eby later this week. Equalization is an incredibly important Canadian national program. I think all of us as Canadians need to be really grateful to the far-sighted past generation of Canadians who put it in place. It's one of the things that knits our country together. It's one of the things that makes it possible for Canadians, wherever they live, to have a comparable level of public service, to have a comparable social safety net. Really, really important. The specifics of the formula obviously are of great interest to provinces and territories. They are regularly on the agenda for the meeting of the federal finance minister and provincial finance ministers, and officials discuss them regularly. And that is as it should be.
Thank you. And just looking ahead now to the summer as the House is rising this week, at the end of last summer, your party was trailing by about 14 points to the Conservatives, and now it's 20 points to the Conservatives. So quite that gap over the last year. And that's after this past year where you've announced some of these measures you've spoken about today, like dental care and pharmacare, like the national school food policy, like your housing-focused budget. But as the House is wrapping up and you're heading into the summer, are you planning on doing anything differently this summer to try to change that trajectory that we're seeing in the polls?
So first of all, truly, my main focus, what I wake up in the morning thinking about, what I go to bed at night thinking about, often what I wake up in the middle of the night thinking about, is what can we do to support Canada and Canadians? This is a really, really challenging time in the world, in the global economy. And, you know, the people sitting here, we're the people right now whose job it is to help steer our country through this and help get Canadians through this. It's a really serious responsibility that we take really seriously. That's what I focus on. I do think, though, that we are seeing some really positive developments in the Canadian economy. Reasons for Canadians to be hopeful and optimistic and to feel that there is light at the end of the tunnel. I spoke about the decision by the Bank of Canada earlier this month to lower interest rates, a really important pivot point, and Canada was the first country in the G7 to do that. It is really significant that inflation has fallen and that for 4 months in a row, inflation has been within the Bank of Canada's target range. That's what made it possible for the Bank of Canada to make that historic move. And I sort of quite intentionally highlighted the report from the IMF. It's always useful to have, you know, objective judges whose judgment you can turn to. And that IMF Article 4 report does talk about how it seems likely that Canada has achieved a soft landing from the extraordinary and extraordinarily challenging COVID economy and Russian invasion of Ukraine economy. So that does make this time a little bit different. And I will say, I think all of us right now are out in our communities a lot right now. One of the things I did over the weekend was visit the Taste of Italy in Little Italy in my wonderful riding of University Rosedale. I talked to a lot of local businesses there, the leader of the local BIA, and Sam specifically said to me that he felt the interest rate move downward was giving the local businesses a lot more confidence and optimism, and he was just seeing at the street level that things were looking up.
Boris Prou, Le Devoir.
Boris Prou, Le Devoir. Madame la ministre des Finances, sur le gain en capital, vous augmentez le taux d'inclusion, mais si c'est une mesure si fantastique, comme vous le dites, pourquoi ne pas l'avoir augmenté jusqu'à 100% pour encore plus de justice?
Merci pour la question. Et je veux souligner qu'on est absolument convaincu que c'est la bonne chose à faire. Et un autre moment clé dans l'analyse du Fonds monétaire international de l'économie canadienne était un commentaire concernant le taux d'inclusion des gains en capital. Je vais le citer en anglais parce que c'était écrit en anglais, si vous me permettez. This is what the IMF had to say about our measure. The increase in the capital gains inclusion rate improves the tax system's neutrality with respect to different forms of capital income and is likely to have no significant impact on investment or productivity growth. That was a very important judgment from the IMF. Concernant le niveau, comme vous savez très bien, dans l'histoire du Canada, on a eu 3 divers niveaux. On a eu le niveau de 50%, on a eu le niveau qu'on a introduit dans le budget de 67%, et on a eu le niveau que le Premier ministre Mulroney a introduit de 75%. Le niveau qu'on a choisi, on a choisi après beaucoup d'analyses. Nous pensons que c'est le niveau approprié pour l'économie canadienne à ce moment-là, pour plusieurs raisons, incluant la compétitivité internationale et incluant des éléments techniques que, par exemple, je ne vais pas les expliquer tous aujourd'hui pour ne pas tanner vos collègues qui ont des autres intérêts, mais par exemple, l'économiste Trevor Tombe a fait une très bonne analyse en expliquant pourquoi il est d'accord avec le choix du niveau de 2 tiers.
Merci. J'aimerais consacrer ma question de relance à M. Holland, le ministre de la Santé. Sur le projet d'assurance médicaments C-64, il semble en bonne voie pour être adopté avant l'été. Dites-moi si je me trompe. Mais la santé est de compétence provinciale, donc j'aimerais savoir si vous avez déjà commencé des négociations avec le gouvernement du Québec pour inclure la couverture universelle que vous proposez dans le modèle de l'assurance médicaments du Québec.
Instance, oui, c'est la bonne nouvelle, absolument, que le projet de loi a été adopté au Parlement et maintenant, c'est le travail du Sénat et j'espère que le Sénat va adopter le projet de loi aussi rapide que possible parce qu'on doit commencer les négociations. C'est vraiment un enjeu d'abordabilité partout au pays, mais certainement au Québec. Et j'avais eu des bonnes conversations avec le ministre Dubé. Et je respecte les compétences provinciales, absolument. Mais je pense pour les Québécois, les personnes veulent que le gouvernement va travailler avec un esprit de coopération, de trouver la façon de s'assurer que tous les médicaments pour le diabète ou pour les contraceptifs sont gratuits et disponibles facilement pour la population. Et on va continuer les conversations là. C'est un peu difficile avant que le Sénat va adopter le projet de loi, mais quand même, il y a des bonnes conversations. Pas à ce moment les négociations, parce qu'on doit respecter le processus au Sénat, mais on va continuer avec la conversation et je suis certain, exactement de la même façon avec le temps. Entente sur les santé primaires ou pour les étangs, pour les années, que c'est possible. Et on va trouver les directions.
Mickey George, Canadian Press.
Thank you. This question is for the Deputy Prime Minister. I'd honestly take answers from any of you up there. But we've seen the Liberal government tapping influencers, and we're now seeing departments using marketing money to also tap influencers to deliver government messaging. I guess why pay influencers? Why do this?
I'm happy to offer a really general answer, which is it is really important for our government to be sure Canadians know what we are doing on their behalf. We work for you guys and we work for all Canadians, and the money that the Government of Canada invests is the money of Canadians. And so we are all really, really focused on talking to Canadians, on being out in person and talking to as many people as we can in person. As you guys know, I used to be a journalist. I still read 2 newspapers every day in print and take pictures of the articles that I share with people. And I am a huge believer in the value of the work that all of you guys do, the work of professional salaried journalists. We also recognize that a lot of Canadians get their information from other sources, and it's our responsibility to be sure that we are meeting Canadians where they are. I don't know if anyone else wants to venture an answer.
When at the advent of television, radio, and print, it took us a long time to understand how to be able to see what was true and how to disseminate information. And there was a great battle at that moment in time to define what was true. And there are forces in this world, and you can look at Putin as a prime example, who are using modern technologies with bots and other ways to disseminate false information, to destabilize democracies by not allowing democratic countries to know what is and what isn't true. And so that is I think, an existential threat to democracy. And I think that when we're having conversations about what is true, it's important that we find new ways to communicate to Canadians where they are, so that we can be able to share what the government is trying to accomplish and why it's doing what it's doing. Because a lie spreads very, very quickly. The good news about a lie, when it spreads quickly, is that once disproven, that people start to get more suspicious generally of the information they consume. That's what happened with print, that's what happened with radio, and that's what happened with television. And I think in the social media age, we haven't yet to get to that equilibrium point. So I think as a government, it's incumbent upon us, and I think of the dental care plan, where we're talking to providers or seniors, or we're about to start, those who are 18 and under. How do we get to those populations to let them know those services exist, to let them know how to navigate those services so that they can understand how they get the care that they need? And if we're not using alternative methods of communicating, then we're going to be failing to connect people to those services, and they're rightfully going to be upset that they didn't get the opportunity to avail themselves of them.
I'll just add, I have 4 kids. All of us up here have kids, and we see that our newspapers on our kitchen counters are not getting read by our children. At least I do. And I'll just say that this is a time where the way in which media is consumed is evolving, and we need to evolve with the times. And certainly when I was Minister of National Defense, we saw in numerous instances that misinformation and disinformation were creeping into our media, our systems across the country and in the private and public sector were being hacked by cyber criminals. And so essentially, I don't think we should look at the use of influencers in a silo. We should actually think about how, as a government, we are responding to the use of misinformation and disinformation to change the way in which people think. And in yesteryear, what was understood to be the truth was more objective. We are now in an era where people debate what is true. And in order to be in the realm of discussing the truth, we need to ensure that the work that we are doing in whatever portfolio is actually disseminated in an honest and clear way so that Canadians can understand what their taxpayer dollars are paying for.
Thank you for all those answers. My follow-up is, if TikTok is potentially a national security risk, then why are you leaning on its influencers to deliver government messaging?
Sure. I mean, as you know, we do take the potential threat posed by TikTok very seriously, and our government has taken real, meaningful action there. That is the right thing to do, and that is certainly an issue which we are discussing with our allies. The broader question of foreign interference and how, as countries, we can protect our own democracy and the democracy of our partners.
And I'll just say that influencers, being influencers, are heard on other media platforms other than TikTok. And what we do, and certainly at Treasury Board, we are responsible for the Government of Canada's cybersecurity strategy. We evaluate each platform for the security risk it poses, together with the Communication Security Establishment. And so we know that influencers are able to reach different sectors of the Canadian population through different media platforms. That doesn't mean that the decision relating to TikTok is somehow wrong. It just means that we need to be using safe platforms in order to disseminate the information about our policy and reach those particular sectors of the population.
Mark Ramsey, the Toronto Star.
Hi, thank you for taking my question. Minister Holland, kind of on the subject of truth, some dental associations in Canada are saying that they've had to launch campaigns to push back against what they say is a government narrative that the dental care plan is providing completely free coverage for Canadians. They say that it's an administrative burden to have to clear up that messaging, and they say that your messaging on that has been misleading. What do you say to that?
Well, I say I've always been clear about how the dental care, how the Canadian or the Canada Dental Care Plan works, and that I think we've had constructive conversations with the dental associations, but it's time to move on. I have never, been ambiguous in any way about how the plan works, and there are folks who are going to come and they have questions, and I understand that poses a challenge, and I'm incredibly sympathetic to that. And the way that we've met that challenge of them having questions with a new program, oftentimes people who've never intersected with a dental care plan before in their life coming and asking how it works, is to say, okay, let's make the administrative burden on this as light as possible. And what we've seen is in communities where oral health professionals participate, that it then creates an explosion of activity of other people participating, because they see how easy it is. And they see that it's actually, in most instances, easier than private plans, and that they're getting paid faster than private plans. And so there's a lot of misinformation out there. I think really with the dental associations now, the issues that we're down to are very, very minor. but the needs are so great. You know, this is an incredible opportunity for dentistry, I would say. This is an opportunity to expand oral health as a key and integrated component of overall health. And to see dentistry not as something nice to have. I mean, it's why it wasn't there and included in the 1960s. It was, at the time, it was seen as being cosmetic. Now we know if you don't take care of your mouth, you wind up with cardiovascular disease. You're going to wind up with all kinds of incredibly dangerous health complications. So we know that we've got to get that right. And, you know, fundamentally to me, when I see a senior, like I was talking about Bill, because he was, you know, he was just in Edmonton, and, you know, it's just the kind of country we want to live in. That a senior who has worked and contributed to this country their whole life can go in and get their mouth cleaned and have a smile they're proud of. Heck, have a pair of teeth to chew with and smile with. I mean, do we really want to have neighbors that don't have those services? I mean, that's what's at stake here. So, you know, if you ask the dental associations, what's the problem? Is it that how long it takes to do it? No. Is it, you know, how much you're getting paid? No. Is it interaction with the program or overcoming any different? No. Like, they're actively seeking. And I think they're actively seeking it, if I could be really blunt, because the Conservative Party doesn't want this to succeed. And calling these dental associations and screaming at them and getting angry at them, terrified, and which is fine. You know, if you're a Conservative Party and you want to vote against this, okay. If you're a Conservative Party, you want to run against taking dental care away, fine. But calling around and bullying and creating all of this negativity, you know, I think that's what the underlying force is. I think that the dental associations, who are normally just dealing as dentists with patients, suddenly are dealing with rabid conservatives who don't want to see this program fail because they're concerned about that it's going to benefit our party. And, you know, Chrystia said, the expectation for each of us here should be on service delivery, on serving Canadians, on getting the job done. And I've been in opposition. Your job in opposition is to point out what's not working and say what you would do differently. It's not to try to sabotage programs and take away services from people. I think that there is a recklessness, a chaos to the conservative movement right now that is seems to be more interested in ripping things down to prove they're broken than they are about providing solutions.
Thank you for that. And just as a follow-up, you had said before that you don't really understand what concerns are outstanding with the dental care associations. They seem to have been kind of taken aback by that. Do you still kind of stand on that? And how are your conversations with them ongoing now?
Sure. So over the last year, and even going before me with Minister Duclos, there were a lot of great conversations and issues raised. We can take the there was a concern about how complicated the contract was to participate with the program. So, you know, that was started off at like 27 pages. We got it down to 2. They still said there was concerns with it. So as of July 8th, we've eliminated it altogether. There was concerns around administration. And as I said, we've really pulled that in. There was concerns about how fast they were going to be paid. We got that down, as I say, most cases 12 hours. We have a 48-hour service standard. There were concerns around privacy. We answered those. So every time they've raised a concern, like we're there, we're with them. And I believe that their concerns are earnest. But I think at a certain point, you know, hopefully we've established trust that we've built a strong program together. And I think the fact that we're now, as I say, in Quebec, over 60% of oral health professionals participating, over 40 across the country, there's a time we've got to get down to the business of actually delivering the service. And so I don't, and I would encourage you, if they can tell you, you know, what the big outstanding issue is, I'd love to know, because I'd love to fix it. But I'm in a frustrated position now where I don't really understand what their issue is. And I'm left to guess, and I've speculated as to what it might be. But we're ready to get the hard work of making sure all 9 million Canadians who don't have oral health care, that each and every one of them gets that service.
Okay, as you can see, Mark is in the right mindset for QP. And I'm so sorry, Mia, but we're going to have to go. Otherwise, we'll be late. We'll get in trouble with the whip and House Leader and all sorts of things.
Okay. That
Thank you
concludes
very much
today's
for your
press
hard work.
conference.